Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. This is the conventional blepharoplasty. This is the technique that gives origin to this procedure, and nothing have changed. Today is the same technique that are accepted all over the world, and that is performed. And this is the technique, this is the resection, this is the scar. The reason why this technique has not changed is because many of patients are happy with the result, and also the plastic surgeons are happy with the result. Plastic surgeon and patient interpreted that this fall of skin is for an excess of skin of the upper eyelid, and the resection of this unsightly skin give this sulcus that is seen like more aesthetic than this one. An excess of skin of the upper eyelid, the resection of the skin, the unsightly fall, and the nice sulcus. And in all these patients can see the same. All this excess of skin, unsightly fall, a nice sulcus. Young patients. But my interpretation of the physiological aging process of the periorbital area is completely different. And I think all that is performed today is wrong, is not adequate to the new procedure, is not adequate to the technology that we have today. I'm going to demonstrate this. For me, this is not an excess of the skin of the upper eyelid. This skin belongs to the eyebrow. It's thicker, different color, and this small skin from the inner side to the outer side of the canthus belongs to the eyelid, and this skin belongs to the eyebrow. And the aging process is in the upper periorbital area. In the aging process of the upper periorbital area is more important the ptosis, the descension of the tail of the eyebrow, like we can see here, than the excess of skin or the flaccidity of the skin of the upper eyelid. Young patients have the tail over the head, and in the aging process the tail is under the head. And the aging process, the natural aging process, produces this sad, tired, and old expression that we can see in this draw. But the conventional blepharoplasty produces the same sad, tired, and old expression. That means that the blepharoplasty accelerates the natural aging process. Rodriguez in 2018 said post-operative appearance accelerates the aging process. The conventional blepharoplasty, the post-operative of the conventional blepharoplasty accelerate the aging process. Also, Timothy Martin asked himself, why does upper eyelid surgery make the patient look sadder, tired, and old? This is simple. If we in the upper periorbital area, it is more important the descension of the ptosis of the tail of the eyebrow, and we reset more skin here. We are produce more ptosis of the tail of the eyebrow. You can see this scar and almost no skin of the upper eyelid was left. Then we accelerate, because if we resect, if the ptosis is the most important in the aging process, and we resect the skin here, we are going to accelerate because we descend more the tail of the eyebrow. And a lot of patients come to see me around the world because they have this tired and sad expression after a conventional blepharoplasty. This picture was taken from internet and is proposed like the most advanced procedure, laser blepharoplasty. This is wrong. They only resect skin with the laser. Ambroise Paré in 1600 emphasized the importance of avoiding over-resection of the upper eyelid. Rodriguez said conventional eyelid surgery produced unsightly results. You can see from 1600 plastic surgeons are saying, be careful. The resection of the upper eyelid accelerates the aging process. Steve Fahim in 2002 said the most common and traditional approach to the upper blepharoplasty has remained unchanged. This is wrong. Since 1994, I performed a procedure that do not remove skin, and for first time I make a publication in 1998. Also in 2017, I write this article in the SAPS International Plastic Surgery, Blepharoplasty without skin resection. I have the congratulations the most important plastic surgeon around the world for the contribution to the surgery. Many patients come to see plastic surgeons and say, Doctor, I want a blepharoplasty, and they pull up the tail of the eyebrow. This is not. The blepharoplasty is going to descend more the tail of the eyebrow. What they really need is the reposition of the tail of the eyebrow. Physiological periorbital rejuvenation that I developed produce a reposition of the tail of the eyebrow and produce a rejuvenation from here to here without removing skin, using modern procedures and modern technology. Is the combination of both new procedure that I developed and new technique that I help to improve. But how we are going to convince the patient that the importance is to pull up the eyebrow when we propose this skin resection here with this scar here or this scar? Also, the endoscopic brow lift that do not resect skin left big incision here in order to introduce the endoscope. Or this in the temporal area. I developed many years ago what I call pivoting brow lift with 3 minimal incision. I only perform 3 minimal incision with this, and I avoid this, and I can treat patient, bald patient, young patient, because I do not leave a scar. You can see no scar, no visible scar. And you can see this patient 30 days after the procedure, you can see a change in the periorbital area. This patient improved the view of the field, Here the patient have problems to see, and just not only improve the aesthetic of the periorbital area, that the patient improve the view of the field. Here can see much better, and also the patient have no headache or no cervical problem in order to see, because this patient can see very well, then pull up with the frontal area and move this one and have headache and cervical headache, also cervical problems. And you can see the result without scars. Then this must be eliminated, and the physiological periorbital area must be. I introduce a new paradigm that is, instead of skin resection, skin damage, skin rejuvenation. Blepharoplasty without skin resection. This is 7 days after the procedure of blepharoplasty, but called blepharoplasty. It's not blepharoplasty, and you can see no scar, and all kind of laxity of the skin of the periorbital area can be rejuvenated and tightening using adequately carbon dioxide laser. And this is possible. For this I use some areas that have no vascular or no nerves in this area, and I can introduce this instrument from a small incision and decollate everything in order to reposition. This is a technique with minimal incision but with important undermining in order to reposition the eyebrow and the forehead. Also, I can reposition the tip of the nose through this minimal incision I can here. The tail of the eyebrow produces this ptosis, not a vertical ptosis, a lateral ptosis. Then the reposition must be to the mid area. And just only put 2 stitches in order to keep the skin in the new position. These stitches I remove 14 days after the procedure. This is 1 stitches in the temporal area where I introduce the scissor, 2 stitches in the frontal area, and this is also my personal technique that I remove the upper eyelid fat pack through this step incision that I published in 1984. And here is how I tighten the tail and reposition through the middle area. This is the patient in the operating room.
¿Cómo estás?
This procedure takes only 30 minutes, 40 minutes. This is 24 hours, and I change this for this. I tighten the skin. Here is a patient with upper eyelid fat pad, lower eyelid fat pad, and this patient have not a severe photoage in the skin. In this patient I'm going to use lower energy of carbon dioxide laser. Then the recovery of this patient must be very, very fast. Here we can see how I use the carbon dioxide laser, and just only remove the upper layer of the skin. This is how it is removed, the upper layer of the skin, and this is the collagenesis. For this reason, this patient 7 days after the procedure is in this way. But if I'm going to treat this patient with a severe photoaging, I must to use more energy of the carbon dioxide laser. You can see here the retraction that have the skin immediately during the procedure. Here we can see the holes that produce the laser. I help to develop a new laser that go more inside the skin in order not only to rejuvenate the skin, also to rejuvenate the orbicularis muscles. Here we can see how is tightening the skin. This is the collagen of superficial, deeper collagenesis, etc., etc. This is wrong. This must be avoided because with this resection it's impossible to rejuvenate to this area. Just only we damage the orbicularis muscle, we damage the skin, and this is, you can see this is conventional blepharoplasty. In the upper eyelid you can see this tired, sad expression, and in the lower eyelid you can see the same wrinkle remain after the resection. All these patients have the same wrinkle after the procedure. Then I use the lower eyelid transconjunctival blepharoplasty that was developed for Bourget and Sarem in these years. I introduce here just only I cut the conjunctiva and the septum, and it's not damage any structures. And here is how I remove. And here also in the conjunctiva no stitches because healing without stitch. Here how we remove all the fat. And from the olden Egypt area times to now, these are symbols of beauty, youngness. And here you can see an horizontal oval. And how, when I see this patient, I think how I can give this patient this look, this beauty, and then using the physiological periorbital rejuvenation, I can get something similar. And this is the patient 4 days after a full face rejuvenation, 7 days after the procedure. And here we can see this. This is similar to this. The eyebrow in a good position, the voluminization that is important of the chin, the tightening and rejuvenation of the skin, not only the periorbital area, just only also the nose, because the aging process is not only the periorbital. The patients are happy when I told them I'm going to rejuvenate not only this, I am going to rejuvenate the full face, the lip, the nose, the earlobe, the mandibular branch. And here you can see also the geometry that help us to see the degree of rejuvenation. You can see a vertical oval. The line that goes through the pupillar is in the upper side of the oval, and here is in the middle of the oval. This vertical oval is changed from this horizontal oval that is similar to the youthness and the beautiness. And here we can see a big change of the face, how the lower eyelid cheek junction is very low here, and the lower lid cheek junction is in the upper position. The improvement also the lips. Many patients here is necessary to resect the skin, but the incision almost are imperceptible. If we see here, the patient look like have several scars, and we can see here almost these scars these are wrinkles, but similar like scars. We can see here is eliminated, and the patient have a very nice shape of the mandibular area and also the neck. The flaccidity of the periorbital area can be tightening and rejuvenation by the use of carbon laser. Few flaccidity or a lot of flaccidity can be tightening and rejuvenation. There is no a degree of the flaccidity of the periorbital area that could not be rejuvenated at tightening. You can see a lot of flaccidity and you can see how it's tightening. This is 1998, just only reposition of the tail. Here I do not use laser. And you can see the change of the expression, 2001. You can see how changed the expression of the look, how improved the view field. This patient was operated for a conventional blepharoplasty. You can see the descension of the eyebrow, how this produced an sclera show, the scar here, but was not able to rejuvenate all the skin because it is impossible. And here is after the physiological periorbital rejuvenation with the reposition of the tail and the rejuvenation with carbon dioxide laser. 1998, 1996. This patient also was operated for a conventional blepharoplasty. The descension of the eyebrow, the sad anti-expression, the sclera show, and all the wrinkles are left. And here you can see how improved this patient, the view field, because this patient have a lot of headache, because have a lot of effort to pull up the eyebrow, and also have cervical problem, because at night all these patients have a movement like this, produce an upper chin in order to improve the view field. This patient will not only improve the aesthetic, this patient also improve the view field, have more headache, and not cervical problem. You can see how improved the view field. Always this is natural result, because I may produce a reposition of the skin. I do not remove skin, and all depend the ability, the capacity of the contraction of the skin of the frontal area. When the patient have a lot of time with golf or horsing or whatever, the frontal area have a fibrosis and they don't contract like other patients, but we can see how improved. This patient the same was operated with conventional blepharoplasty, and here we can see this skin belongs to the eyebrow, and here is only the upper eyelid skin, and we can see how produce the laser, the contraction of the skin. Young patient that have problem to see, and this is the result after this technique. 24 hours, and here we can see no visible scar, nice natural result that not improve only the view, the aesthetic of the periorbital, that also improve the view field. I operate a lot of young patients with the same problem. This is a soccer player that his visual field had diminished. And here is 48 hours post pivoting lift. You can see the difference between the conventional blepharoplasty and the physiological periorbital rejuvenation. Sad, tired expression, nice expression. In 2004. "44 hours." Also, you can see the nice how I reposition of the tip of the nose with this procedure. No visible scar, not the scar at all. Robert in 1988 said although blepharoplasty has long been the traditional method of improvement the aesthetic appearance of the eyelid, it yields little improvement in several of the major signs of periorbital aging. What said Robert is, with this technique, it is impossible to rejuvenate this. Conventional blepharoplasty lack of ability of improvement. Another cases, I have more than 3,000 patients operated and treated. This is in 2004, 15 days after a full face rejuvenation, face lift, neck lift, nose tightening, lips, everything 14 days after the procedure. What happened with this procedure? Have less edema, less hematoma, because in some eye area do not resect the skin. For this, these patients are a faster result, less side effect, and this is the important. 9 years post-op, you can see how maintain the eyebrow in this position and how the tightening of the skin with carbon dioxide laser have last long results. I hope you enjoyed this presentation. If have you any doubts or you want to send pictures, you can contact with my team. Have a nice day.